Did you know that in Singapore, 1 in 5 children and 1 in 10 adults suffer from eczema? If you're one of them, then this following video is for you. Hi, I'm Dr Yong and welcome back to my channel. In this video, we'll be talking about the differences between eczema as well as other red, flaky, itchy rashes that may be common in Singapore's condition. So what are the key differences between eczema and rashes? Now, eczema is also a very big category and very big umbrella term to describe either an endogenous or genetic form of eczema tendency, as well as something that's exogenous and acquired, such as irritant contact dermatitis and allergic contact dermatitis. Before we start to derive the differences between eczema as a category and also other forms of rashes, it is first important to understand eczema as a whole. Let's talk about eczema. So eczema commonly we can see in early presentation in infancy to early childhood in the form of atopic dermatitis. Atopic dermatitis is actually a term that describes a genetic tendency towards developing eczema in typical locations such as the flexures of the arms and the legs and can persist from childhood all the way to adulthood. Now, of course, the severity varies, but there are also individuals with atopic dermatitis who have other atopic diseases coexisting at the same time, such as asthma and allergic rhinitis, and sometimes they occur as a triad as well. Other than this genetic tendency towards eczema that we call atopic dermatitis, there are also individuals who suffer from acquired form of eczema, which is more treatable actually in the form of irritant contact dermatitis and allergic contact dermatitis. What is irritant contact dermatitis? Irritant contact dermatitis can develop in any individual, whether or not you're genetically predisposed to eczema. This is because certain harsh chemicals, for example, alcohol, sanitizers, soaps, when used in excessive amounts can actually cause barrier dysfunction and stress to the skin. Take for example during COVID times when we were all taught about hand hygiene and use a lot of alcohol sanitizers and hand rubs. Then fast forward there and you see over months the development of an increased rise of patients suffering from hand eczema. This hand eczema is not actually endogenous or genetic. In many of these individuals, it was acquired because of an excessive use of these harsh contactants, which of course if you take away and reduce and rebuild the barrier will go away and will treat the actual irritant contact dermatitis. There is also an entity known as allergic contact dermatitis, which means it doesn't happen to everybody, but only to individuals who actually develop a true allergy, as opposed to irritation. Allergic contact dermatitis can happen to random things such as nickel, for example. So patients who have a nickel allergy may start to develop maybe like a belt rash around the buccal area or develop allergies to certain earrings that they put on. Other forms of allergic contact dermatitis can come in the form of latex gloves as well. So for example, healthcare workers who get repeated rashes on their hands may actually be found or tested to be latex allergy. So there you have it. You have irritant contact dermatitis and allergic contact dermatitis, which are acquired forms of eczema that can be treated if you can elucidate the underlying trigger and remove that from the environment. And you also have atopic dermatitis, which is a genetic predisposition and is something that's a little bit more of a chronic disease process that has to be handheld over a patient's lifetime. And there you have it, a little bit of a summary about what eczema is. And now we're going to delve into the other category we're talking about here, other rashes. So now, not every red, flaky, scaly or even itchy rash is due to eczema. Very commonly, eczema is often overdiagnosed and many of these rashes that present in Singapore's humid weather may not be actually eczema. Take for example, heat rashes. Heat rashes happen when there is actually basically blockage of your sweat ducts and follicles because of an increased humidity and basically maybe sweating and exercising in the environment that's very warm and hot and having occlusion of the sweat ducts. This pesky rash can appear like this pinpoint red bumps over like the covered areas of the body, like the chest and over the trunk as well. And then reducing these exposures, cooling down the skin, using certain application of very calming lotions can also help to alleviate this condition. There are also some immunologically triggered rashes such as after viral infections. There's a condition known as pityriasis rosea or PR for short. This is triggered usually after a viral or bacterial infection and sometimes there's no clear-cut etiological factor other than having a history of a patient feeling slightly tired, being under the weather, and then they develop this red onset rashes about a couple of weeks after, sometimes starting with a larger, bigger circular patch like a Harold patch, almost looking like a fungal rash, and then multiple small patches develop over the trunk and spreading and radiating down the limbs after that. There are also other rashes that can be due to fungal infections or true viral infections, for example, and hence it is important that we differentiate these rashes because the correct treatment is essential because they're treated very differently. It is not so easy to tell apart eczema from a regular rash for lay people, but there's certain tricks that we can sort of like look out for, certain telltale signs that can maybe help us to differentiate between them and the probability of them happening. Take for example, atopic dermatitis. Atopic dermatitis is genetic by nature and tends to be bilateral and symmetrical. So if you have a patient with atopic dermatitis, typically the rash can be bilateral, for example on both sides of the cubital fossa, which is the infos of the arms, and also the popliteal fossa, which is the back of the knees. This is a classic location for atopic dermatitis and also can include areas like the neck as well. On the other hand, a fungal rash may start off unilaterally. So if you have a rash on maybe one side of the foot and happening in the toe webs, for example, where it's humid and damp and then spreading out from there, that may be more fungal in origin versus eczema, which may be bilateral and maybe start on the top of the feet as well. If you look at heat rashes, this is typically heat triggered, and so typically in areas of sweating, in occlusion, underneath a damp shirt like the chest and the back will be a classical location where you see these pinpoint rashes develop. Finally, we also talked about the differences between genetic forms of eczema like atopic dermatitis as well as acquired forms such as irritant or allergic contact dermatitis. Let's first talk about the prevention and treatment of eczema. This all depends on the severity, but important key foundational principles include protecting your skin barrier. Going on to the treatment with medications, there is controversy with regards to topical steroid use in excessive amounts. As a dermatologist, I do not promote excessive use of topical steroids, especially potent class steroids, but sometimes it may be necessary at the beginning to try to reduce a severe flare-up. It is important, however, to balance this against the location and the potency, and then transit to other options such as non-steroid substitutes like calcineurin inhibitors or PGE4 inhibitors that are available today. This is in the form of tacrolimus, pimecrolimus, and even crisaborole, which is also very safe to be used above 2 years of age. So it's important to go from the acute treatment phase onto the chronic management phase, especially in atopic dermatitis, and steroid spare where possible. So we always want to step down and proactively use non-steroid medications to try to manage and keep eczema flare-ups at bay while ensuring that the barrier is well prepared. We can also then escalate treatment to including oral medications if necessary. Sometimes this can come in the form of a pulse of oral antibiotics if there's superimposed impetiginized eczema or eczema staph aureus flare-up. So you see that antiviral and antibacterial treatments may be necessary orally in certain cases when there is superimposed infection on the eczema-prone skin. And then we talk about, other than the oral medications, longer-term oral medications that help to balance the immune system or response. There are older class medications that have been traditionally used, such as cyclosporine, for example, that help to reduce severe eczema and manage it better on a daily basis if needed. But do note that there's also advancements on these oral medication options. We are now in the wave where we have something called JAK inhibitors as well, which are more targeted and more specific at just shutting down one arm of the immune system that causes this inflammation in the skin, and that can be very useful today in the management of atopic dermatitis that is severe. So there you have it. There is really a ladder that your dermatologist can go up to depending on your severity of eczema, because not everybody is the same, and management can include general measures like proper skincare, protective mechanisms, but also incorporating certain medications when necessary if the eczema is more moderate to severe and is also affecting the quality of life at the same time. In general, however, there are good prevention strategies and management strategies that hold fast or hold true to both. For example, your showers. Keep your showers short and avoid very hot showers. Use room temperature or use cool showers instead. It's more calming on your skin, whether it's due to eczema or another form of rash. Secondly, use comfortable, breathable clothing. Avoid synthetic fabrics that may be harsh on the skin, such as woolen products that may scratch on the skin as well, and use maybe lightweight cotton, which can be very comfortable whether you have a fungal rash or eczema. Thirdly, moisturize your skin. Use appropriate moisturizer adequately on your skin barrier. It helps to calm the skin down and also helps with the repair of the skin post-rash. Fourthly, important not to scratch. Whatever it is, whether it's due to eczema or due to a fungal rash or due to bacterial infection, try not to scratch. Scratching actually aggravates the rash and can actually perpetuate more wounds and also then give rise to poorer healing and more scarring downstream as well. Remember, whether you're dealing with eczema or rash, you are not alone. There are many people who suffer from this, and it's important to understand what the possible causes and ways to manage them are. If you have any questions, don't forget to drop them in the comment section below. Do not forget to like and subscribe to our channel for more educational content on skin management.